You're watching The Resonator. This is Whitcliffe.com. I'm Sylvia Ward. This segment is part 3, following up on a statistic that I mentioned last time that did not look good for Utah. Take a look at this color slide. This shows Utah among the top 6 states in the nation with the highest rates of chlamydia. However, if you take a closer look at the slide, you will see that positivity among 15 to 24-year-old women is tested in family planning clinics. This data comes from family planning clinics in the state. On our last segment, the chlamydia rates for Utah in general were actually well below the national average, ranking at 45th in the U.S. This family planning clinic data is quite a contrast. I wanted to know more about this high statistic, so I did a little research. First, to begin, it's important to know the definition of a family planning clinic. According to the Bureau Director of the Bureau of Epidemiology, a family planning clinic is any clinic that receives federal funding. In Utah, for family planning clinics, that would be Planned Parenthood. However, the director also informed me that Planned Parenthood also funds other clinics. For example, in Weber County, Midtown Clinic is funded by Planned Parenthood. And there is a question as to how many other clinics, or even Midtown clinics, are funded by Planned Parenthood. The STD data, or chlamydia rates collected at Midtown Clinic, are included with Planned Parenthood of Utah's data and are categorized under the family planning clinics at the CDC. Now, looking into this high chlamydia rate from family planning clinics for females ages 15 to 24, I came across some interesting information from the CDC concerning STD reporting and monitoring. Trends in chlamydia reporting are more reflective of changes in diagnosis, screening, and reporting practices than of actual trends in disease incidence. As areas develop, chlamydia prevention and control groups, including improved surveillance systems to monitor trends, the data should improve and become more representative of true trends in disease. Well, this information brought questions to my mind, which was this. Is the high chlamydia rate for the family planning clinics reliable? A Planned Parenthood nurse informed me that there are people who give false information when they come in for chlamydia testing. When they test positive for chlamydia, Planned Parenthood tries to locate them to get them treated. If they can't find them, Planned Parenthood returns the information over to the health department. The nurse assured me that it was rare that this occurred. So I was curious, how does the health department identify people who give false information and have chlamydia? I spoke with an STD nurse at the Weber Morgan Health Department and asked her this question. How do you track down an individual who has tested positive for chlamydia but has given you false information? The nurse's response was this: we can't. There's no way it can be tracked, and there's no way we can police that. Now, that answer was not an answer I expected. I thought there was some type of statistic on the website or written policy that I could take a look at. Needless to say, I was shocked. The nurse also stated that this happens all the time, which was quite contrary to what the Planned Parenthood nurse had stated, that this was actually a rare occurrence. Now, this new shocking information had me saddled with a whole new set of concerns. The first concern I have is that it appears that the system is broken. The STD and pregnancy reporting, monitoring, and surveillance system is broken.